everyone. Welcome to Global Genes Patient Advocacy Summit. Welcome to RARE patients, parents, and caregivers. Welcome. We are going to speak today on addressing the needs of adult and senior patients in RARE. I am your moderator, Maria Hadjidemetriou. Next slide. I'm the executive board member for the Cooley Anemia Foundation and an expert patient advisor for the Thalassemia International Federation. But most of all, I am a very passionate patient advocate for more than 20 years. Next. The aging thalassemia patients. Now, in rare disease, this is very, very common. I'm just going to give you one example, as I was diagnosed with thalassemia, also known as Cooley anemia. And as we age, we battle not just a primary disease, but a handful of secondary diseases, and just a few are osteoporosis, pulmonary hypertension, and diabetes. Hospitals and our patients' organizations are not prepared to handle the aging patients. Next. The journey of one thalassemia patient is a dear friend of mine, Lisa, who was diagnosed with osteoporosis 3 years ago. In 2018, her osteoporosis advanced where she fractured her femur bone. Just to tell everyone out there a little bit of education on osteoporosis, it is treated with a drug where the main agent is called bisphosphonate, and after 5 years, the femur bone will break. Doctors are not saying this to the patients, so there are a lot of patients out there fracturing their femur bones, not just because of osteoporosis, but because of also this drug that has bisphosphonate. So wheelchair became her permanent means of mobility. In the images below, you're going to see how in just 3 years, Lisa disintegrated. She passed away March of this year, just a few months ago. And in the last image, you will see that it was just a few days before she passed away, and she has dwindled down to like 85 pounds. Next. So where do we go from here? We need to create wellness centers within our hospitals that provides alternative methods of healing. Acupuncture, acupressure, pranic healing, physical therapy, all of these great alternative methods that's not covered by health insurance. We need a more holistic approach to our rare diseases, meaning a whole thing, the whole picture. Next. As for our patient organizations who are doing their best to stay afloat post-pandemic, with some not meeting their fundraising goals, we need more than ever support from the industry. We need pharma and biotech to be our partners and build programs with our patient organizations to serve the aging rare disease patients. The aging rare disease patient has come to unprecedented financial challenges, and this can lead to stress and even mental health issues. Next. So we need to find ways to support adult patients as they face barriers to finding good medical care as they transition from pediatric to adult healthcare settings, financial strain from managing work concerns and medical costs, and I need to add piling medical costs. Mental health issues that result from stress of managing all these challenges, often without any support. Thank you. I'm going to introduce our panelists who will be speaking on these incredible topics and uncover some solutions. We have David Ross from the Rare Disease Awareness Men's Group, and beautiful Jennifer Fields, who is founder and president of the Hills Tandem Strategy, Planning, and Management for Good. Sarita Edwards, who we heard from yesterday, a wonderful presentation. Thank you, Sarita. She is the CEO and president of E.WE Foundation. And honored to have Reverend Odell Cleveland, who is Chief Administrative Officer of Mount Zion Baptist Church of Greensboro, North Carolina, and also a caregiver. Thank you, panelists, for being here. So we're going to take on mental health challenges. And David, if you can speak on that, are you here with us?
Yeah, I'm here. Can you hear me?
Hi, David.
Hi everyone. Hi, yeah. So since being diagnosed with my rare disease over 4 years ago, I've realised that a lot of male patients, caregivers that are suffering with their mental health, but for a number of reasons, unable to speak out and seek support for themselves. For anyone living with or impacted by a rare disease, it's important to talk about what you're going through. So I decided to set up Zoom calls. This would be an opportunity to connect with other males, speak about what they're going through and offer support. My aim is to change the culture around rare disease, mental health, with it having the same emphasis as physical health. The group is important as it provides males a safe space where they can share their feelings about being impacted by rare disease and how it affects their life. Males seeking therapy is something that isn't easy to do, but vital, especially for those who don't have a support network around them. Because this, in my view, can cause some adults to feel isolated with their condition if they don't have any support. And even if they do, it's important to have rare people, rare connections who understand how you feel and what you're going through. Also, the need to retain your identity is important, as a fair amount of time is taken up by hospital appointments. I also think that the financial impact is something which gets overlooked in the rare disease community for adults. With some people only getting diagnosed when they're adults, but some people are not being diagnosed as children and not being able to have the opportunity to earn an income or enjoy a job that they're passionate about. One thing also that has been discussed in the male group is the impact of having a rare condition on relationships. For me, having conversations with my child who doesn't have a rare disease, but concerned about my health, is something that as she's got older, I've needed to have better discussions with, really. Also, single rare people, particularly men in the group, have expressed their concerns around dating as they feel their rare disease puts off potential partners. To sum up, I feel that whilst we wait for cures therapies for rare diseases, more focus is needed for support for rare disease, especially for men. For myself, losing my mother to the same rare disease as me, as well as my nephew to another rare disease, has impacted my mental health, as well as my daughter's. Feeling isolated is also something that rare disease male adults have to face, and specialised counselling is what I would like to see offered for rare disease male patients and caregivers. This would help with their daily lives, benefiting relationships with other people. Also, educational opportunities, it needs more focus. I know several males in the group that have had to give up their jobs because they've been diagnosed as adults with a rare condition. And also possibly people that haven't had the opportunity to work at all, having something to do in the day, whether it be paid or unpaid, would benefit them. Rare disease males needs can be complicated depending on the individual, but it's important to give men the voice which will enable them to have the articulate how they are feeling and get the support they may need. I'd like to share a quote from my rare disease friend Emma Henderson III, who's helped me set up the group, which is, "We can't do much about the physical side of our health beyond going to the doctors, but we can do something about our mental health, which is really so vital in terms of living with the rare conditions that we have."
Thank you, David, for that presentation and giving us such insights on the male and what they go through with their rare disease and how isolated they can feel. And you touched on the financial challenges, and my goodness, I can't imagine, because, you know, males are supposed to be like the figure that supports the family, the kids, and then they're the ones that are now having to take off from work and probably not work. And what happens from there? It's we're going to speak about financial challenges and also transitioning from pediatrics to adult care. Jennifer, you have experience with that, so would you speak to us, our audience, about that?
Sure. Thank you, Maria. David, that was a great summary of, all of the challenges that come along with being a male with a rare disease and not having the resources that are there to support them. And I do want to transition into the transition topic, but I guess I'll start with some of the work that I do is related to some of the community groups and the rare disease community, specifically sickle cell disease. I live with sickle cell disease, so the experience is definitely a close one. And I think there are many others across the country, including sickle cell and other rare diseases that don't have access to the appropriate resources. And that means that most children are born now and living to their adult phases. Most children with a chronic disease walk a tightrope. They have a harness on them, and then they also have a safety net underneath them in case they fall. But that's not the same for adults. If a patient takes a fall, the entire team is ready to stand by, supporting them, building them back up, putting them back in the right lane of life. And then for a very long time, people with rare disease were not expected to live that long, right? So we're thinking, or I was told as a child, you may live until you're 12, years old. So I'm 37 now. So thankfully that didn't come to pass, but that's the story for many, many people. And sickle cell disease, simply because of penicillin, prophylaxis, other medical advances, again, you get to see me here as an adult and some other people who are living as adults. But for this reason, no one's ready for the adult population. No one is ready for us when we transitioned over to becoming adults. The reasons why, I believe that the transition programs that were created are not available, or if they are available, they're very scant, they're very few. The resources are not there for the community to be able to really engage with the community appropriately to provide training and educational programs that they need to transition appropriately. Another problem with sickle cell disease, I will say specifically, is that there's a lack of providers. There are hematologists and oncologists who do definitely work with patients who live with sickle cell disease, but your training in oncology allows you to also have training in hematology, but many of them don't go into hematology, specializing in sickle cell. So that leaves a huge gap, a huge deficit of, adult providers who are able to work with people who live with sickle cell, like me. And then the other problem is that as hematologists or oncologists are being born, the new ones are not being born to treat sickle cell disease specifically. So there's a huge gap in the knowledgeable providers who are able to treat our population. And I'm sure this is probably very similar for other diseases as well, but I'm speaking specifically for sickle cell. The ones that are available are retiring. They've been doing this for a very long time. They're amazing at what they do, but again, there are new heme experts that are being born. So that causes a huge deficit. And then another challenge is that there are so say I'm going to my primary care provider. My primary care provider needs to be knowledgeable about sickle cell disease. They need to know who to refer me to if certain symptoms occur. My labs look a certain way. But a lot of times they don't even have this very basic and general knowledge. And in studies, PCPs have admitted to not knowing enough about how to treat a person with sickle cell disease. So they stay away from it completely. And with this, if I have issues or someone has issues with kidney challenges or, lung functioning, they're not going to know who to refer to. They're not going to know when to refer or how to refer, so that, hopefully some preventative actions can be taken so that you can hopefully prolong a person's life and the quality of their lives. Adults are left stranded. I would just say that. So a lot of times adults are left stranded. And can you imagine leading a life of uncertainty and not knowing if you're going to have a life of health and happiness, if you're going to have relationships that are strong and that can support you? You were thinking, who's going to take care of me? How will I keep a job? How will I make hiring, or how can I complete my college degree so that I can work and maintain, my own employment, or maintain, sustainable resources for myself or my family if I decide to start one? And how do I simply enjoy life is the big question, I guess. So all this comes full circle, and it goes back to David's topic of mental health, and it goes back to just living a simple everyday life, something that I think we take for granted more than not. But I just wanted to close it there to say that more resources are available or needed for people who live with chronic disorders as they become adults. And And I would love to invite any conversation from Odell or Sarita to just hone in on Maria, the topics of mental health and transition.
You know, Sarita here. Hey, everybody. Listening to you both speak on your specific challenges, it's very apparent that adults are underserved. And it's very apparent that that adults are falling in the cracks, right? I think of our healthcare system in terms of access to care, resources, you know, a great segue into the financial burden associated with rare illness. I think specifically for mental illness across the board when it comes to rare illnesses, I think it's something that all of us touch on, right? Like you don't have to have a mental illness. You don't have to have a mental health diagnosis to be experiencing a mental health challenge. Caring for a family member who has a rare illness, that's caregiver burnout is a real thing, right? Like I think we look for these high-tech definitions of what these illnesses are when they are a part of our everyday lives. Mental health is really, really real. And I think men, as David so pointed out, are being more overlooked than we realized. But I think there's this masculinity that comes with being a man, and they're expected to just kind of deal with it and that's not okay. Even in the sickle cell space, I've heard several patients in the adult space speak about showing up in the emergency rooms and feeling like they're not being seen or heard because they're just wanting the medication. That's not okay. I think we need to figure out how we can create a space for adults to be heard and to be seen and to be cared for. Just speaking to resources, I think when you really think about it, there are probably 6 million adults living with a rare disease between 18 and 64. There's probably 6, 7, 8 million adults 65 or older living with a rare disease. And how many of those actually got that rare disease diagnosis as a child? Many of them did. And so a lot of them are now faced with coverage gaps because their insurance has maxed out, or they currently don't have the support of family members or friends. There are some insurance providers who are stepping in saying, if your child received this diagnosis as a kid, we will continue coverage past the age 26. So I think that's great. That's one improvement that we've seen. But what about the person who received their diagnosis as an adult? You know, they never started the journey as a kid. They the first time as an adult. And so now they're newly diagnosed. They have a pre-existing clause in their insurance. And so now they have this new diagnosis, but the insurance won't cover it because it falls up under a pre-existing condition. Like it's so many barriers and so many things that I think there's room for us to improve. We just have to take the initiative to do so. And I do want to give Pastor Odell an opportunity to speak as well.
Well, thank you so much. One of the things that as a leader in a very, very large African-American faith community, we try to always be an advocate. So when a lot of the insurance companies or the local healthcare providers, from the primary care to the specialists, case in point, a lot of them attend somebody's faith community. So we ask certain questions from that perspective and ask them to get involved. But to your point specifically, when you start looking at advocating and being proactive, it makes a huge difference. Now, I smiled when you said men, masculinity, and all that. All that went out the window for me a long time ago. As a caregiver for my mother, who, and not going into all the details, but we found ourselves as children caring for her. And a lot of caregivers just find themselves. Life taps you on the shoulder and says, your turn now. And a lot of times we were not prepped. We didn't have all the information that one needed. And also we have family dynamics and a whole lot of other things. So when you think about it, as a leader from a micro perspective, but also from the macro perspective on leading a community, but how can you lead a community without getting involved with one's personal situation? So I will say this and come back later on when I have another opportunity. One thing about being a caregiver or rare disease and taking care of people, I try to explain it this way. It's a time and a season in all of our lives. And from a caregiver's perspective, it'll either be a time when one needs a caregiver or one will be called on to be a caregiver. So we go with it appointed time. And the second thing is the duration of time. How long, Lord? How long will I be a caregiver? For some of us, we've been a caregiver ever since we can remember. When my mother's situation happened and she found herself disabled, I think I was 6 or 7 years old. And trying to do the necessary things, trying to do the physical therapy, trying to do all those things that we were told by the specialist that if you could help her do this, and we all know the story, that she'll get better, but guess what? She didn't get better. And over the years, she's gotten worse. So now at 78, we're doing everything as a caregiver from changing the pins to everything else. And I'm a male, so masculinity went out a long time ago. We're trying to work through it. And the last thing is this. Once we dealt with an appointed time, you may be a caregiver or in need of a caregiver. The second thing is the duration of time, how long, and we know where that usually leads to. And the third thing is this. When my time as a caregiver is over, to Maria's point, her friend who passed, will I feel guilty or relieved? And will I feel guilty for feeling relieved? Because see, that's the question that I talk to my own siblings about. When we sit there, if we have to be on the front row of our faith community at my mother's funeral, or we're in the family car, or we are sitting there in the cemetery, when it's all said and done, can we hug each other? And can we say we did the best we could? And can our mother say, I'm proud of you all. I raised you all right. You did the best you could. Because as a caregiver, it's always hard. And I don't want to start getting all emotional, but at the same time, I just think being an advocate from the macro and the micro perspective, because a lot of times being a caregiver from a family perspective did not come with instructions. Thank you.
Oh God, thank you, Reverend. Just so touching. And your mom is so lucky to have you as a son. And I wish for all parents to have children like you, where they will care for them to the very end. So I want to go back to something that Jennifer said, and it hit me because I have a genetic blood disease, just like Jennifer, thalassemia, sickle cell. And two things. One, our hematologists are aging out, and these younger doctors don't want to go into hematology. They want to go into oncology because that's where all the money is, the cancer drugs and all that. So we need to really do something to get some expert hematologists for our genetic blood diseases. Second thing is, when we transition into adult care, I transitioned into an oncology unit. And I thought, okay, wow, culture shock. There's no one, I'm in a tiny little cubicle, and the support isn't there. The relationship should have already been built. I need a cardiologist now, an adult cardiologist. There's no one. Where are the relationships that have already been put in place by my hematologist? Same thing with an endocrinologist. And to Sarita's point, how many times did I end up in ER where I was a doctor explaining what thalassemia is? So the sickle cell patient who goes into the emergency room that has a crisis, what's next? They're not prepared for us. What do you think, Sarita? And for the rest of the panelists, because I'm leaning on pharma and biotech having to partner with us to build out programs, and the hospitals for really opening their eyes and thinking out of the box to build programs for the adult rare disease patient. So just some feedback. What do you think?
So I think it really starts with, just kind of speaking to the transition piece that Jennifer spoke on. I think it's really important to have transition programs in place, and not let children become adults, and not have an understanding of their diagnosis, not have an understanding of their rare diseases. But in the same regard, I think for adults who are diagnosed as adults, there should be programs and education available so they know what they're dealing with. I mean, think about the diagnostic odyssey that families encounter with their children. Well, imagine being an adult, having that same diagnostic odyssey. For the first time, you're experiencing symptoms, and now you're seeing all of these doctors. I think it's estimated 10 to 12, 13 years before some families get a diagnosis. Well, if that's the case for an adult, imagine being 40 when you first start this process, but now you're 50, 55 before you ever get a diagnosis. That's a lot of time. I think we just have to figure out how we can be more efficient and how we can do it sooner rather than later. I think we need just more proactive alternatives to what we're doing for the rare disease community.
Yeah.
I want to add to that too, Sarita and Maria, kind of leaning on to what you said, but I wanted to add a stat that I had just on a different project come across. And it says the US sickle cell disease treatment market is expected to reach 1.7 billion in the US by 2023, and globally 7.71 billion in 2027. Now, where are the resources from all of these for the community, for the person's other side of their life, not the clinical side, right? The clinical side is one, we do have some resources there, but the other part of the patient's life, mental health issues, the caregivers who are out there struggling with a patient, or our families, where are the other resources? Even if it was just 10% of this that was given back to the communities, I think people can live a full life, a better life, quality of life, and the resources, community organizations that are there can really thrive and help these groups grow and transition, right, appropriately. And even some incentives be born for hematologists who do think about possibly going into sickle cell disease or other rare diseases where there are no specialists. So I agree. I lean into them as well, pharma as well as one resource that can really help to bridge the gap of the services that are needed for our communities and for the people who take care of us.
And I think too, just to piggyback off of that, sharing stories like this, sharing our stories and our journeys, I think that's one way, that we reach medical students, for example. They have to hear why it's important for them to take a different path, right? I think if no one sees the value in supporting you, they're not going to. And I think that stems across whether it's, healthcare. I think it stems across whether it's caregiver support. I think people have to see the value in what you're presenting and bringing to the table. And I think that starts with sharing our stories. I think that's why doing so is so important, because that's when change starts, right? With conversation. And conversations doesn't start until you start opening up your mouth and talking about it. And I think that's what we have to do more of.
Yeah, we need to open up that dialogue. And David, I can't help but think the mental health issues that happens in the men's group. Are you seeing any partnerships from like pharma or hospitals where they're open to building out programs for you guys?
No, not at the moment, but this is something that been going through my mind really. Kind of, I've been doing it just over a year now. It's gone from one meeting a month to two. But yeah, where does it go forward? I think it needs to go forward. Whilst it's nice, the small sort of 10 to 15, and I get regular meetings. Yeah, it needs to go up a step or two and beyond really, because more support is needed. And but I can't do that on my own really. Yeah, it's a bit of a crossroads point with me really. Well, we've got to work out where to go next with it, because that's something again that's really you've got to navigate all that yourself really. You kind of find out which is the best way forward, which is confusing really. And that's kind of the same with being diagnosed with a rare disease. It's kind of I was diagnosed at 41, So, you're left to find things out yourself. You're given a bit of information about groups and you look up online. But yeah, navigating all this on your own isn't easy.
Yeah, the diagnostic odyssey, Sarita, that you mentioned. Oh my goodness. I can't imagine being healthy your whole, childhood and most part of your adult life, and then boom, all of a sudden symptoms coming out of anywhere. What's going on? And you go for blood tests, go for blood tests again, go for blood tests again. And then your work is impacted and you might get fired. It's crazy what the diagnostic odyssey can really take you into a mental state. And I wish for that not to happen to anyone. I almost feel blessed that I was diagnosed right away at 2.5 years old with thalassemia. But how can we just really be there for someone going through this? Is there anything out there for these individuals that are going through the diagnostic odyssey?
Yeah, not as far as I'm aware. I know a rare disease father who was diagnosed in his early 30s. He was a teacher. He was very athletic, but then his symptoms suddenly came on. And yeah, it's been a big thing for him to come to terms with quite a big change in life where he's had to give up work. Very active with his children and very much a busy life to now almost a completely different life, it feels. So yeah, it's something that we're just left to sort of deal with on our own, I think, certainly in his case.
Mm-hmm.
Yeah.
And I think it's a really good point too, Maria, when you were speaking to the diagnostic odyssey and just the conversation of trying to be diagnosed. I know a lady who she had symptoms for years, and she was her journey wasn't even identified as trying to figure out what was going on. They were treating her for something completely different. And just all of a sudden it became, oh, you have a rare illness. And that's when she began to learn more. And so she thought back just all those years where she was going to the doctor, being treated for the exact same symptoms. So just imagine being on that road, not even realizing you're on the road, right? And having to just backtrack. How long have I been trying to figure out what this is? And how long have we been treating it? And it's actually something else. And so we have to have, just like you have child life services for children. I think we need adult life or something for adults, really, right?
That is excellent. That is excellent. You heard it here, and someone should go and run with it and get this going. I'll tell you what else I find incredibly unempathetic, and that is corporate America. I mean, they need to really become empathetic. If they value you as a worker, they need to value your human life. You need a day off to go get blood tests done to figure things out. My God, give it to them. I find corporate America, when we talk about inclusion, somehow rare disease is not included. So we need corporate America to also open up their minds and their eyes to the rare disease community.
I agree with you, Maria. I just wanted to add this one thing. That's the reason why I own a business, because I worked really hard in corporate / nonprofit America for about 12 years until I decided I'm going to do this on my own. I'm going to have set my own hours, and I work really hard. That's not even an issue. But you're at a company for 2 years, and one day you said, "Hey, I'm not feeling good. Can I stay at home? I'll work from home." They look at you, as if you're telling a lie. And then they're ready to say, "Well, I don't know if we need to discipline you we're not sure we trust you." What do you want me to say? I've been here for 2 years without taking one single day off. Mm-hmm. But I do agree with you on that. But I wanted to kind of ask a question for Odell. I know you talked about being a burden, being a caregiver, but from my perspective sometimes, and from other people that I know, we see ourselves as being a burden, right? You want to get married, and maybe you have been married, but then your spouse, you just decides, that they don't want to be in that life with you, that walk with you. So that's a hard part. And also being a caregiver, I feel like you choose a life of potentially having to lose everything one day, if you are a caregiver, if you're married, I know several people who have been married to people with sickle cell disease and have lost every single thing because of the work challenges and things like that. And then for a patient, you just don't want to be in that position. You don't want to be the hindrance to someone's life. So that leaves you with another mental health issue, David, that leads to, you live a life of solitude or a life of just being really isolated and closed off from everybody else, even your family sometimes. But David, have you ever heard your mom or, her speak of that side of things and how she talks about being the person who needs to be cared for?
Yes, great question. Our situation is somewhat different. When you start looking at a mother, and to your point, talking about family dynamics, she was a divorced single mother of 4 children when her incident occurred and she's disabled. So now she looks and always say, thank you so much for coming back caring for us. But our family is 3 of us left. Sister got tragically killed in a car accident, my baby sister. And we look at it this way, Jennifer. If one single Black mother can take care of 4 children in Charleston, South Carolina in the late 60s and early 70s with everything that was going on from integration and everything, then we are committed that the 3 remaining children will take care of this mother with everything we have left. And at the same time, we have families and all the family dynamics with siblings or with our spouses and grandchildren. So I just think that caregiving, in my case, and I don't want to speak for everyone, but a lot of people feel the same way, is meant to be enjoyed, not endured. And when I take that perspective from that to the faith community, when we start talking about the social determinants of health, the United Healthcares of the world and other big companies are willing to come in. Someone mentioned earlier, a lot of times, where do we go from help? Yes, these insurance companies, yes, these local hospitals, foundations will come in and help. But to Sarita's point, we have to open up our mouths. The faith community and other communities have to be an advocate. We have programs from lupus to suicide to everything else because it's all happening in our community. So we talk about it. We have panel discussions about it. And when you open up and take the stigma away, people come and they gravitate to each other and said, you know what you were talking about, I was feeling that way. So it's not a self-diagnosis, but at the same time, I think the faith community has to be put in that same bucket as institutions that has some blame. So we're trying to do better, but I think to everyone's point, this is where it starts. Let's have a conversation, but we have to do more than have a conversation. We have to be an advocate. So I thank God. Maria said, my mother is blessed to have me as a son. And I say, thank you, Maria, but we are blessed to have her as a mother because she walked one day 3 miles with a wooden cane in her right hand and a metal brace on her left leg to keep them from putting me in special ed class. So she walked. And if she could do that for me, if she could be an advocate for me when I was a child, how could I not be an advocate for her?
God bless. God bless. Thank you, Reverend. We have a question from Nancy Lurie. How can I help the adult men in our patient community reach out and potentially join the rare disease men's group? So, David?
Hi, yeah, thanks for the question. We have international Zoom calls for male patients and caregivers on the last Sunday of every month and middle of the month on a Wednesday. So there'd be 12 o'clock Eastern time. So if I give out the email address for that, and you can contact me or one of the other guys who helps with the group, and we can help you with that. So it's rarediseseh@gmail.com.
Thank you, David. So Adrian McBride asks, are there any resources that patient advocacy organizations can share about financial issues, burden, and insurance issues that arise in adulthood? I don't think there are enough resources. That's the problem, right? So you guys, what do you think?
I think there are resources, but I think you have to hunt for them. I don't think they are just readily accessible. I don't think if you ask your practitioner, they're going to give you a printout with a list of resources. I'm not saying don't do that. I think you should start with your practitioner. I think you should always, whenever they give you, you need a new this or a new that. I am a huge advocate in encouraging patients to say, is there a resource for that? That should be the very next question. So I would start with my practitioner and say, do you know of any resources that can help with this, or this? And if they don't, maybe do a Google search, maybe reach out to organizations like Global Genes and see if they can connect you with some people. I wouldn't just jump on the first thing that I find. I would definitely research what I find, if searching for myself, because sadly, there are organizations that will take advantage of situations. And so, but I would start with my practitioner. I would reach out to organizations like Global Genes and see if they can connect you. Last resort, do a Google search, just research what you come across.
Okay, thank you, Sarita. Does anyone else want to add to that?
I think she covered it, but I do just want to add, that Google research, look for community groups specific to a certain disease. Sometimes those groups specifically will be able to direct you to resources, even if they don't have access to the resources themselves. They could probably help you get connected.
Okay, thank you. And Parvati Krishnan asks, there are so many barriers, so many cultural barriers that play a role in making this a more inclusive community. This was to Reverend Odell. And another comment, lastly, partnering with mental health groups to help support rare disease communities such as Talk Space. So wanted to mention that. Okay, and any last thoughts? We have 2 more minutes left to the session. Any last thought that we can give words of wisdom to our rare disease community?
Yes, mention the culture barriers. Of course, different cultures handle situations like this differently. What I would say, the advice is be your own advocate also, and challenge things that is not right. Because in a lot of cases, it's done intentionally, but a lot of cases, we don't know what we don't know. So let's not assume that Odell is doing this or someone is doing that for any other reason. Once you bring it to one's attention, then give them opportunity to fix whatever the situation is. So I just always found to be an advocate for myself and others, not just yourself, but myself and others, because if we build a pathway for one or a bridge for one, others will come behind us. Thank you.
Thank you, Reverend.
Really
Go ahead.
No, I was just going to say, kind of along those same lines, just find your voice. I think it's really important to find your voice and recognize when you're complaining about a situation or when you're advocating for a situation. And I think a lot of times it's really easy to get confused with our complaints being a method of advocacy for change. If sometimes complaining is not what we need. We need to talk about it, try to find solutions, and create opportunities to make things better. So that's one takeaway that I always like to share. Turn your complaint into an advocate opportunity.
All right.
That'd be great.
Thank you, panelists. Did anyone want to say anything else before we close off?
No.
Okay. Oh, God. Thank you, everyone. And I can't help but say again, industry, pharma, biotech, we need you to partner with the patient organizations, because we can actually build out programs that what we saw in Lisa's journey won't happen to any other rare disease patient. We cannot leave anyone behind. So thank you, everyone.